Did you know that March is National Nutrition Month? With spring just around the corner, this is the perfect time for families to make better food choices and build better habits together. Here to tell us more is Buckeye Medical Director, Dr. Blanda. Thank you for joining us, Doctor.
Thank you for having me.
First, why is Buckeye Health getting involved with National Nutrition Month?
Well, Buckeye Health Plan realizes the importance of nutrition in one's overall health. And so we really want to start to emphasize the impact it can make on chronic disease like heart disease and diabetes, obesity, and depression. And so we know that 1 out of 10 people get the appropriate amount of nutrition from fruits and vegetables. And so that's a pretty low number, and we'd like to see that improve.
And let's discuss more about the importance of getting that proper amount of fruits and vegetables.
So fruits and vegetables are great because they provide vitamins and minerals and different nutrients to your body. Those nutrients are going to improve your immune system, they're going to strengthen your bones, they're going to make your muscles stronger. The other thing that we know is that eating fruits and vegetables does improve chronic disease. So fruits and vegetables have chemicals or nutrients in them called antioxidants and phytochemicals, and those can help chronic diseases such as diabetes. They can even help things such as cancer. The other thing that eating fruits and vegetables does is it makes you feel full, and so you're not eating a lot of junk food. After you eat fruits and vegetables, you're going to feel more satisfied with food. And the last thing fruits and vegetables have is they have a significant amount of fiber in them, and so that will help your digestion, kind of keep people regular and make sure that they don't have digestive diseases such as diverticulosis and things like that.
I'm a vegan myself, so I know the importance and how good I feel with getting all of those fruits and vegetables. So how can families, no matter what their diet choices are, make sure that they are getting enough nutrition?
So, it's difficult for families. You have a busy family, everyone's schedule is different. So one of the things we say to families is that you should plan a meal together with each other and really plan it out, that we're going to schedule it, that on Wednesday we're going to have a meal together and we're going to talk about what we're going to eat. When you have that meal together, it should be a time where the family is not distracted with phones and other things, social media, TV on. You want to have a time where we're just talking amongst ourselves. So that special time together, and then the time that you take to prepare for that. You prepare when you meal prep and you go to the grocery store. You ask each other, hey, what do you want to have? Should we have shrimp tacos on Tuesday? You talk about those things that you're going to do together. And it's important that you engage kids and family in that because then it emphasizes to them the importance of nutrition. So kids can help with prepping food and they can also help with kind of cleaning up on food. So all that is important. The other thing is if someone comes up with an idea that they want to have something that maybe isn't your favorite, you're open to variety in those meals and you're willing to try recipes, or if someone has a recipe, you change it to be a healthy recipe.
And making some of those healthy choices at the grocery store, swapping out your cans of pop for perhaps drinking more water isn't going to be enough to create a lifestyle, making sure that you're making those choices every single day. So what tips do you have for families who want to make eating better, building better habits, a lifestyle?
Well, I think it's important that we look at the 5 food groups that we always emphasize for people. And, we talked about fruits and vegetables. Fruits and vegetables should be half of your plate. And they should be very colorful and you should have a variety. Then you want to make sure you're getting protein in your meals. And it should be a lean protein, so you're thinking of things like poultry and fish, nuts and beans and eggs. Those will help make your bones strong. They'll help to make your muscles recover and be strong. The other thing that we encourage people to do is not to take processed grains. We want to be using whole grains in our food. And so eating different types of food like whole wheat bread instead of white bread, things like rice and quinoa are good sources of a whole grain type of food. The last thing are your dairy products, things like milk and yogurt and cheese. You don't want to eat a ton of them because they are a little bit higher in fat, but you do want to eat some of them. And then, of course, staying hydrated. And by staying hydrated, we're really trying to use water instead of any kind of sugary drinks or salty drinks.
And Doctor, we discussed why Buckeye Health Plan is getting involved in National Nutrition Month, but how are they getting involved?
So Buckeye Health Plan has a really cool project where they get involved with the farmers markets across the state. And so they do sponsor a day at the farmers market. We give the members a voucher for $15 where they can go to the farmers market. For many people, they haven't been to a farmers market. So being able to go there, we will usually have some type of educational materials, maybe a food demonstration, and some giveaways that people can have. And so it's a great place to see what is local produce that can help you boost your fruits and vegetables.
Well, Doctor, March is National Nutrition Month, but thank you for giving us all of these tips so that we make sure that we're taking care of our bodies the entire year. Thank you again to you and to Buckeye Health. And for you to learn more information, just visit Buckeye Health's website on your screen.